my name is Sue Harrison, and I'm going to give my informative speech today on concussions, one trauma changed my life. The morning of Thursday, October 18th, was pretty much routine like any other day in my house. I got ready to go to work, put my cell phone in my pocket, and headed out the door. I gave my husband a kiss goodbye, told him to have a good day, and that I loved him. And I also told my son to have a good day, and then I loved him as well. Little did I know then that 15 minutes later, my life was going to change forever. On the trip to work, I suffered an anaphylactic or severe allergic reaction, which did cause me to lose consciousness while driving. A lot of what I'm going to tell you, I don't remember a lot. I've been diagnosed with amnesia with the accident, and if you do notice me kind of teetering side to side, my apologies. It's just part of the recovery process with a moderate concussion. While I was driving, the last thing I do remember is crossing the center line and hearing an oncoming car honking at me. I then knew I had to try to get, at least in the gravel, possibly in the ditch, get my foot off the gas to slow my vehicle so I would not hurt anybody else. I really don't remember much from there. I have no recall of any events after the crash, and so I'm kind of going on what the rescue personnel and those at the scene did tell me. Okay, the brain of the average adult is about 3 pounds. And it does float inside the skull, and it floats in cerebral spinal fluid, or its abbreviation is SCF. And that acts as a shock absorber for the brain if there's any minor impacts. Just to demonstrate, I'm going to show you here. I have just a raw chicken egg. I'm going to crack it. When you crack it, it's pretty well, it floats in the fluid, not scrambled, anything. And think of this as the skull and this is the brain. Now I'm going to show you what happens when your brain has a sloshing effect. If you notice that brain tissue, it isn't the same. It's not the regular egg floating, but as you can see that egg white and the yolk have meshed together, so it's similar to what happened to my brain on the impact of the accident. Okay, the impact of my Ford Escape, I went up an embankment. It accelerated my head forward. It caused my brain to strike the inside of my skull, and as my vehicle was tossed and turned, the force of the impact caused my head to be rapidly rotated from one side to the other. It caused my brain to repeatedly strike my inner skull at opposite sides, and again, almost a sloshing motion like we've seen with the eggs. My brain tissues were basically sheared and strained. There's delicate neural pathways. Those were damaged, and I do suffer a lot of neurological disturbances right now. If I'm up, my endurance is pretty down. If I have done a lot of activity during the day, I literally lose control of my muscles and have a lot of twitching. Almost looks like I am having a seizure, but that I'm not. As far as my ambulance trip into the hospital, again, I was unconscious the whole time. My level of consciousness steadily decreased, and my heart rate, which in a normal adult should be 60 to 100 beats per minute, dipped into the single digits. One of the simple gauges that medical personnel use to determine your level of consciousness in any individual that suffers a traumatic head injury is known as the Glasgow Coma Scale, or the GCS. The test is pretty simple. It's a reliable and objective way to assess the initial and subsequent level of consciousness in a person after a brain injury. The test correlates well with outcome following severe brain injury, and it's used by the EMTs or paramedics at the scene of the accident, also in emergency rooms, and even in the intensive care units once the patient is at the hospital. What the Glasgow Coma Scale looks for is the eye opening in a patient. Is it spontaneous? Do the eyes open to sound of voice? Do they respond to pain? Or is there no response? Verbal response ranges from normal, disorientated words but not coherent, or no words but only sounds, or no sounds. Motor responses range from normal, localized to pain, withdraws when there's pain, or what's known as posturing. And that's literally where a person will tip their head back and their hands are like this, almost in a pushing away motion. All of the areas that they look for are scored from 5 being the best to 1, which equals no response. When I did get to the hospital, my coma score was 12, and according to the grading scale of the GCS, or the Glasgow Coma Scale, a severe concussion or head injury would be from 3 to 8. It's not possible to get less than a 3. A moderate concussion is from 9 to 12, and a mild concussion is 13 to 15. Some of the medical imaging sources, such as CT scans or MRI scans, are used to look for any intracranial bleeding or any damage to the brain. And sometimes, even though those are normal, there is still damage there. People may feel a little bit discouraged. Luckily, my scans, came out okay, but definitely there are some neurological deficits that I'm still suffering from. Since my Glasgow Coma Scale was at 12, and because of my decline in my level of consciousness, I was admitted to UW Hospital, to the trauma unit, overnight. As I said, I really don't remember much. I remember being in the emergency room and thinking, oh my gosh, they're going to cut my shirt. And I couldn't actually sit up and say that or put my hand up there, but I just remember the scissors as they cut off all of my clothes, pretty much just going right down the center. I think one thing that I'd really like to just stress to everybody, it's very important that you wear your seatbelts always when you drive. It's not just a maybe or a I forgot. You always use those seatbelts. If you do have a young child in a car seat, make sure that you're not placing them in that front seat where the airbag may make contact with that seat. There's actually been injuries and deaths. The best place for your child is in the middle of the vehicle, in the back seat. That is the absolute safest place for them to be. Airbags do save lives, but they have to be used properly. A lot of the injuries, according to the National Transportation Safety Board, occur because people are sitting so close to the steering wheel that airbag opens up and it deploys, and they're seeing even some fatalities. In 2009, there were over 3,000 lives saved because of airbags. My vehicle that I was driving the day of the accident had airbags, only the front airbags. However, even though my crash was at 55 miles an hour, climbing an embankment, and then I hit a tree, my airbags did not deploy. So that is something that we're working out with Ford, just to find out. It's not that I want to get rich from this or expect any of my medical bills to be paid. I just don't want this to happen to anybody else. Concussions, they really do alter the way that your brain works. Again, they're rated from mild, moderate, or severe. And every year, an estimated 1.7 million people sustain a concussion. And they are a contributing factor, about a third of them, or 30.5% of all injury-related deaths in the United States. And 75% of traumatic brain injuries that occur each year are because of the concussions or other mild forms of traumatic brain injury. Motor vehicle crashes are one of the leading causes of death in the U.S. The economic impact is notable. The lifetime cost of crash-related deaths and injuries among drivers and passengers was $70 billion in 2010. Most people with a concussion recover quickly and fully, but for some people, symptoms last for days, weeks, or longer. In general, recovery may be slower among older adults, young children, and teens. Those who have had a concussion in the past are also at risk of having, if they do sustain another concussion, it does take longer to recover. And that is the case with me in 2006, and ironically in October, I also suffered a concussion, again in a motor vehicle accident. That time I was hit as I was turning left. Someone tried to pass me on the left. Symptoms of a concussion really fall into 4 categories: thinking and remembering, physical, emotional, mood, and sleep. Living with a concussion is difficult for the individual sustaining the injury, but it also affects the family. Pain, balance, and muscular issues and vertigo make driving and returning to work dangerous. Just some of the signs of and symptoms of concussion that I'd like to share with you today: a low-grade headache that does not go away. If you're having more trouble than usual remembering things after a bump or blow to the head, paying attention or concentrating, organizing daily tasks, slowness in thinking, acting, speaking, or reading, if you get lost or easily confused, neck pain, if you feel tired all the time with a lack of energy, if there's any change in your sleeping pattern, if you sleep for longer periods of time than you did before the injury, any trouble, again, sleeping or any insomnia, you may have a loss of balance, you feel lightheaded or dizzy, and you will have increased sensitivity to sound, lights, and distraction. Sometimes the vision is blurred or the eyes tire easily. It's definitely something I can relate to. In the first accident, I hit the left side of my head, and I have a floater in my eye, which if you look out of your eye, it's a little black spot that comes and goes back and forth. And I have noticed since this head injury that definitely that area has gotten bigger. And sometimes I almost have to try to look above or below because it seems to be right in the middle. There's just a black spot for me. Loss of sense of taste or smell. May have ringing in the ears. Mood changes. You may feel sad, anxious, or listless. You may become easily irritated or angry for little or no reason and have a lack of motivation. Along with the loss of consciousness, I think one of the hardest issues for me is not having any recollection or recall of the accident. They've diagnosed that as accident-related amnesia. I may never remember what happened. Some of the things I've been told is that sometimes it's the body's way of cushioning you, so you can't remember a traumatic experience. It's just pretty spooky when it happens. Pain control is also an issue. My personal choice is not to take narcotics or analgesics. I'm just going to show you quick. I have what's called a TENS unit. It delivers electrical impulses to muscle groups. Just going to turn it on here. And I'm able to set whatever pressure that I need. And then I attach the electrodes to my skin. I have 4 here, so I have 2 sets. And that kind of zaps my muscles and kind of gets those to relax. So far I've been very pleased. Definitely seems to be working. One of the other things that I did get to wear home is called some of you may know it as a cervical collar. This is called a PMT. The front plate here went under my chin, and then I had a specific thing to go in the back. Every other day, which is kind of a pain, you have to detach these nice little pads in here because they start to kind of stink and get kind of oily with your skin, and you have to wash them out and dry them. That was kind of a hassle. It did help, though, relieve my pain, which I'm grateful for, and supported my neck. So it was sort of a comfort to me. I find that I'm very frustrated nowadays. Even the simple task of getting dressed and what I have to put on first is pretty perplexing. And there are times that I just live in a state of total confusion, not remembering who I talked to, what I'm supposed to be doing, what day it is. Some of the tasks I'm having trouble with. Don't remember to eat, brush my teeth, even take my daily medications. It seems pretty overwhelming, so one of the strategies I have used is to keep a little notebook, and I write down what time I do everything so I can remember that. I really want to know why this happened. I've really been searching for reasons, and I've not gotten a whole lot of answers yet. I do continue to have just the blackout or syncope fainting episodes, and I know that my most important job right now is to rest my brain and my body. One of the new diagnoses that I was given was post-concussion syndrome, which means very little. It just means, okay, I've had this concussion and the symptoms are lasting. I am in physical therapy right now. It's really a challenge to not only my mind, but my body. But I'm grateful because I have gotten some relief from the pain and, some answers as to why things are happening. And I am making forward progress. Emotionally, it's still a pretty dark time for me. A lot of sadness encapsulates me, and I'm very afraid to drive anywhere. Financially, as a family, we struggle because we are dependent on both incomes. I did have to get a different vehicle because my Escape was totaled. So after many, many years, I'm having to pay that car payment again. Anxiety and worry fill my days. Sometimes I feel like I am really a burden to my family because I need a constant babysitter. Physically, the bruising has faded, but the muscular and the nervous systems battle my body every day. Recovery from a concussion is rough. Cognitively, there are no guarantees to recovery, but I'm going to make it and I'm going to adapt. Just again, anytime you drive, be sure that you wear your seatbelt. Make sure your passengers do. If you're ever involved in a car accident, make sure that you replace, if you have a child in a child safety seat, replace that seat. Be checking that child safety seat. Make sure that that's secure. Sometimes seatbelts do loosen up. And I think that's one of the things that I found many years, having been an EMT, that parents did not take the time to actually make sure that seat was secure. I guess in ending, I want to just let everybody know, anybody could be like me. Your life could potentially change in an instant, as mine did, because of one trauma and the after effects in the form of a moderate concussion or traumatic brain injury known as a concussion. Thank you.